Concussion, minor head injury, and MTBI are frequently used interchangeably, and these terms often mean different things to patients, families, researchers, and healthcare providers. So what is an MTBI? In 2004, CDC and other experts came together to create a definition for MTBI. They concluded that an MTBI is defined as an acute brain injury resulting from mechanical, direct, or transmitted energy to the head from external physical forces. An MTBI also leads to one or more of the following symptoms: confusion or disorientation, loss of consciousness for 30 minutes or less, post-traumatic amnesia for less than 24 hours, and/or other transient neurological abnormalities such as focal signs, symptoms, or seizure, and a Glasgow Coma Scale score of 13 to 15, 30 minutes post-injury or later upon presentation for healthcare. This definition still holds true today. However, recognizing the heterogeneity of presentations and outcomes of children with MTBI, the CDC guideline used a broader definition of this injury. The guideline definition is inclusive of pediatric patients ages 18 years and younger with Glasgow Coma Scale or GCS scores of 13 to 15, with or without the complication of intracranial injury on neuroimaging, and regardless of potentially requiring a hospital admission and/or neurosurgical intervention. For this training, we will use the broader definition of MTBI from the CDC guideline. An MTBI is associated with a force or impact to the head or body that causes the brain to accelerate and decelerate with translational, rotational, and/or angular forces. Injury can result on the side of the force, which is called coup, or on the side opposite the force, known as contra-coup. These direct or indirect forces are believed to lead to a wave of energy that passes through the brain tissue, injuring it and triggering neuronal dysfunction involving a complex cascade of ionic, metabolic, and physiologic events. This cascade, as well as microscopic axonal dysfunction, may lead to acute clinical signs and symptoms. In most cases, this process will correct itself, and the majority of patients will have a good recovery over time. Current research suggests there is a particular concern for MTBI among children. But why? Reason 1. A developing brain. The inherent differences in a child's developing brain, such as less white matter and pruning of neuronal connections, are believed to make them more susceptible to the chemical and metabolic changes that occur with MTBI. Furthermore, axons in a child's brain are not as well myelinated, which may also predispose children to traumatic injury. Reason 2. A developing body. Younger people have less well-developed musculature overall, including cervical and shoulder musculature. This means they have a decreased ability to absorb mechanical energy throughout their body. A child's developing nervous system and thinner cranial bone also may increase the risk for traumatic brain injury. Reason 3. A developing curiosity. Finally, while the natural curiosity and risk-taking behavior of children and adolescents have many benefits related to learning and development, these traits can also place them at an increased risk for injury, including MTBI.